beautiful people, welcome to my YouTube channel. My name is Miss Linda, and if this is your first time to be here, I'm a special needs educator, and we are having Trixie for the third time. If you have not watched the first video and the second video, please go and check out the first video and the second video. We have talked about early intervention for the first video and the second video, and there's so goodies in those two videos that you need to know and you need to share with someone. So for this video, I'm giving it to Trixie to take us through. She's like the one now who is hosting me.
Okay, thank you. It's good to be here. My name is Trixie Pujol, and I'm a clinical counselor with 30 years experience with families and children. And I specialize in autism. I also do counseling with children and adults, and some adults and young and adolescents. And I do parenting, help parents navigate their kids. So today we're talking about autism assessment, is what you had asked me to talk about. Yeah. But before we can talk about assessment, we need to have awareness. Yeah. And I know we've come a long way in Kenya in the last 12 years. I've been here 12 years, and I have friends who've been, who've been working in autism in Kenya for much longer, and friends who have kids with autism who are 30 years old, so they've been walking this path for a long time. And I know the history of, what was available 30 years ago, what's available now, and the awareness and knowledge has come a long way all over the world, and particularly in Kenya. So we're doing a great job.
And definitely in Africa.
And definitely in Africa. Yeah,
I feel like in Africa, we have too much culture that's hold us back.
Holds you back. But we've come far. And at least in Kenya, we've come far. And I think in this region, we're probably come the furthest, and we have the most knowledge and the most more people who are trained in autism.
That's in Kenya.
In Kenya. But that said, there's still a lot of people out there that have misconceptions, have cultural beliefs, have views of curses and stigma around autism and any special needs. And so it's really important that as we do look at assessment and intervention, we also look at, is there enough awareness? And I'm going to just mention a few really great organizations that do awareness. There's SEP, Special Educational Professionals, that do a lot of awareness and intervention. There's organizations like where I'm housed here at Autism Support Center that does lots of grassroots and Kahawe Sukari, yes. I can never say that. And they have a center here where I'm working that has speech and OT. And also a dear friend of mine, Abby Brooks, who does walks around Kenya, and eventually will do them around Africa. She's a young woman with autism, and she walks around Africa and around Kenya to raise awareness. And again, like, she'll go into the villages, and she goes far in and deep in the bush and really meets people and helps them understand what autism is, because assessment's great and we can send people places, but if we don't even know what to look for or what it is, if we hide our kids, or we just have no idea. So I just think it's really important that we acknowledge that we're at a place where there's a lot of kids ready for assessment and intervention, but there's still a lot of awareness still needs to be done.
That's
just wanted to mention that.
And it's not only in autism. We need to do a lot of awareness
in all different developmental disabilities and mental health. We were talking about this before. I think that's an area that's and then even then, like, we might know a little bit about Down syndrome or cerebral palsy or the deaf and the blind, but then there's
disabilities as well. Learning disabilities.
I was just going to say dyslexia, ADHD. Those things, you get kids get told they're stupid, or they can't focus, they can't, they're told they're not well-behaved children, but really they have a hidden disability. So anyhow, I just wanted to plug in that awareness is still really important as we also move into assessing and intervention.
Okay.
Race, religion, socioeconomic background, everybody can have any of these disabilities or conditions.
And Trixie, thank you for taking us through the support system where people can
there's so many great, and maybe we can link them on all the different organizations that are doing really grassroots things.
We'll do that. We'll link some of the organizations that work and support children with autism on this video down there.
Wonderful, great.
So now
you are aware, and now you're like, okay, well, what does my child have? I don't know much about these things. Is it autism? Is it ADHD? Is there a learning difficulty? What's happening? And so now it's, where do we go? And that's also a really hard question. You like asking me hard questions. And I think in Kenya, there is some government services. We like to say there's none, but there are some. There's the Educational Assessment Resource Centers, the EARCs, which which are run through the government through the Ministry of Education, and they've been around for a long time. But some of them are better than others. Some are better staffed, better equipped. The special needs teachers or the OT have more information and knowledge, or often you can go to an EARC in one district and maybe the person who's running the EARC, their specialty is the hearing impaired, or their specialty is learning difficulties. So they don't know anything about autism, but maybe their specialty is autism, or they know enough about it, or the OT knows something. So that's a place to start, is at your ministry, your education office in your district or your county. So I think that's the first place to start. And then, if you need, that's great. These other organizations that I'm talking about, they do a lot of grassroots work and are in the communities and are doing assessments and providing services. So SEP, Autism Support Center, Walking Autism does a big awareness campaign, but there's others too. Those are the ones that are just coming off the top of my head. And then the next step is, okay, so then we get to these places, and then there's special needs teachers. There's Kise and Kasarani that does assessments. A lot of the hospitals do it. Again, it's how well that person is trained there, so that can be really hard. But Kenyatta National Hospital does it, Gertrude's, and it depends on where you live, what your accessibility is, what your financial, what you're looking for. And then there's lots of private practitioners that assess. Doctors, some pediatricians assess or refer. So a good pediatrician, we have about 3 really good developmental pediatricians in the country now. And so I think one is going to Gertrude's. We have the CDC at Gertrude's, 2 of them at Aga Khan. Not every pediatrician is comfortable diagnosing. 2
in Aga Khan and the 2
one I think is going to Gertrude's now.
Children's Hospital, the main in the Muthaiga.
The main one in Muthaiga, I think, but we need to call, and some other pediatricians might be able to diagnose, a neurologist may, diagnose it as well, but some aren't comfortable or some aren't really knowledgeable in it. But generally I'm finding most pediatricians don't diagnose if they're not comfortable. But they might they should refer, and they don't. But then there's people who are specifically trained in that. I'm trained in a tool called the ADOS, the Autism Diagnostic and Observational Scale. And in many countries that's considered like a top standard for assessing. But as we were talking earlier, it's not always culturally appropriate. It's not always relevant. It's not always needed. I had a toddler in here this morning, and both the doctor and the speech therapist and I who were assessing this child decided that we don't need to do the ADOS. Like, we know that he's got enough red flags to do intervention, and he's so little that we're just going to wait a little while to do an actual diagnosis, but we're going to do intervention, and we're going to give intervention tools to the family. But other times it might be that the ADOS is just not culturally relative. There's very few people who are doing it. And yet if a child's older or it's really not clear if they have it, it can be a really good tool if it's appropriate for the family. And then we talked about there's some screening tools. The MChat is a great screening tool. And really everybody could download that. Teachers, doctors, everybody should be doing that. So if you have a kid with developmental delays who's a toddler in the first 3 years of life, the MChat's a great tool. You can just download off the internet, MCHAT, MChat. And that's a great first screener to identify if there's some concern. And some of the red flags are specific for autism. But if your kid has enough of those, then you want to refer them on to somebody who has more ability to assess and diagnose. But the MChat could be used by teachers, therapists, doctors. It's a great first tool. And there's lots of other screenings. There's the CARS, the GARS. There's lots of other screening tools. The ADOS is a standardized tool. That means it's compared against other kids that age. But again, it's not appropriate for everybody. What I do caution is, if you go to somebody who's assessing your child, that they sit against a desk and they look at your child from a distance, they ask you a few questions, they might give a couple toys to the kid, and then they make a decision. You have to engage with the child and play with the child and rule out other things, make sure their hearing is tested. Even if it seems their hearing's okay, best practice says we rule out the hearing. Ideally, in the best case scenarios, you have more than one person assessing a child. Maybe not at the same time if you can't be in the same room, but you have a good pediatrician. You have maybe a speech therapist therapist or an OT or a clinical psychologist or counselor that knows something about autism. So you're creating that multidisciplinary team that can really look at the child from different angles. And it's important to know when to bring in a neurologist, because some kids you would need to see a neurologist to rule out any other neurological issues. A lot of kids you don't need to. So it's really important to know what the assessor's abilities are and where their limitations are, and when you have to pull in other professionals. I don't know if that answers the question. It's not easy to diagnose autism. It's not a blood test. It's not a yes and no. It's subjective when you're looking at a child. So it's really making sure you're ruling out things, you're doing an intensive background with the parents, you're interacting with the child, you're ruling out any medical concerns. Yeah. So it's a holistic approach to looking at a child.
So it's not something that you wake up and decide, okay.
Yeah, it's not so easy. And you want to make sure that, we've ruled out anything else. We're looking at all sorts of different aspects of the child, and we're looking at the child holistically.
Okay. So what do you think, now that you also do assessment and you diagnose autism, what do you feel, or what do you like, what can you advise or options that you can give parents who have not yet?
Yeah, I think that's a really hard one. I think it depends on where they're located physically, if they're up country, if they're in Nairobi, if they, what access what realistically can they get to, especially we're in the middle of COVID. Also, what can they afford? So there's a lot of different factors, and so I think asking questions. I think, again, for empowering parents to go to the district hospital or go to the local ER. And if they don't like the answer, it doesn't make sense, don't just take it that somebody in a white lab coat or somebody who supposedly is a professional or has this degree told you this. If it doesn't make sense, either yes or no, ask more questions, go to more people, look on the internet, make phone calls, contact other people and find out what else you can access. It's a hard one. It's very difficult because it's not always clear cut.
Okay. Now, okay. This is the last question, but now that for those parents now who have maybe gone through the diagnosis and the child is quite tender age, and they still not into it. They feel like, no, I don't have to believe on this diagnosis.
So the diagnosis is only one part of it. The diagnosis can help us, but the intervention is more important. The diagnosis helps guide us. If it's, just like if you have malaria or if you have cancer, it's really important to know the difference. If you have cerebral palsy or if you have autism or if you happen to have both, it's really important to know that to help guide the treatment. But in the end, it's with autism, again, it's not medical generally, unless they have a medical condition as well. If they have epilepsy or seizures like fits, absolutely, you need to see a neurologist, you have to get medication. But if there is no other medical underlying condition, then it's really about the intervention. So if maybe a family's in denial or something doesn't make sense, okay, that's fine. The label isn't so important as getting good people working with your kid and making sure you're learning it. Like we talked before, getting all the nanny, the housekeeper, the aunties, the grandmother, everybody involved in the intervention. The label isn't as important as it is good intervention. It is helpful, it guides us, it's useful.
Knowing if your child is autistic, knowing if your child is cerebral palsy,
if your child is ADHD, it's important, it is. Important. But if it's that, is it autism, is it not, that
you're not so
query
sure.
in the middle, maybe you're not so sure. And some kids kind of fall right there where it's not 100%, it's right on the border. It's still the intervention. We still do intervention. Because we look at the symptoms.
Okay.
So one child might present with no speech, one child might present with a lot of speech, but it's not functional communication. I have a little girl that comes here, she's 4.5, she's very talkative. She can label things, she knows all, she can look at one of my books and it's a horse, it's a cow. She knows her number, she knows her ABCs, but she's never communicating that to somebody. While I might have a 2-year, the little one that was in here this morning was 15 months, and he was signing more, signing milk, signing water, so he was communicating. So even though he's much smaller too, but he doesn't have a lot of language, he was playing with me. He was smiling and laughing with me. So he looks very different, and he's presenting in one way, and so his intervention is going to, even though he's much younger, he's going to go one way. My 4.5-year-old, her intervention is going to be all about connecting and she already has some language. I want it to become functional to me. it's great if you know all the labels of everything, but if you're not communicating that to somebody. So we really treat the symptoms that present. You know, and you could have 2 4-year-olds with very different symptoms, and you're presenting what shows up and what that child needs, and that's what you're going to treat. So it's really important. So 2 kids could both have autism, both be even the same age, but their treatment plans would look really different because of what their needs are. So you have an overall idea of what you're doing with autism, but you treat the individual symptoms. You treat what's showing up in front of you.
Okay, you treat the individual symptoms.
Yeah.
Oh, that's a take home.
Yeah.
Thank you so much for being on the channel.
Thanks for having me.
And I know parents out there are super grateful for the knowledge, because I always say that knowledge is power. You know, and the knowledge now you're giving us today will help someone might be stuck somewhere. Great. Or might be feeling, you know, might not be in the same page, but now this kind of knowledge is able to help someone now even have confidence, even know, oh, this is what I needed, or this is me, what I need to change, or this is how these things works. And I honestly, knowledge is something that special needs parents need. For sure, all over the world is what they need. Because you see, many years ago, there wasn't any knowledge. There wasn't. Yeah. You've been here you have worked with children with special needs for the last 30 years. You can see what was there 30 years ago and what is here today. It's been, you know,
and I've seen it in different countries, in the States, and then I've seen it even in Kenya. In 12 years, huge difference in knowledge and awareness. And so we want to, and also it's access to information. 12 years ago, people didn't all have smartphones. People couldn't access the internet so much. It's a lot more access, which is helpful. WhatsApp groups and Facebook groups and YouTube channels and all of that is very helpful. It can be overwhelming, but it can also be access to information is really important. And knowledge is power.
It's power. Yeah. And now you have hand and make sure the best thing you can do. The only way you can support a child with special needs, it's make sure you share this video. Make sure you tell someone, and let them subscribe, and let them learn, let them know what you have known or what you have heard today that you didn't know. We appreciate you, the viewers, and we appreciate you much more.
Thank you. Appreciate you.
Yes, thank you for coming on the board. So see you on the next video. Bye-bye.
Bye.